Good news, $32 million worth of good news. Everybody ought to have a good sense of accomplishment related to this news. I simply want to say that we should commend Supervisor Yaroslavsky for the introduction of a motion in September that aided the process in moving forward at the request of the Department of Public Health, followed in November by a motion by myself and Supervisor Antonovich that adopted a nutrition policy set of recommendations that further augmented and more strategically positioned the Department of Public Health to be competitive. And so the work is paying off. It is an important statement. The Obama administration is to be applauded for moving this agenda forward. It is very important as it relates to the issues with which we are confronted here in the county of Los Angeles, the largest employer at the local level of any municipality or comparable jurisdiction across the nation. What does this mean? It means that the county of Los Angeles, specifically the Department of Public Health, is providing significant leadership for what it means to move an agenda to help people become more physically fit and healthy. And I think we ought to applaud ourselves for being in the forefront of this movement. The data with respect to adult obesity in South Los Angeles is abundantly clear. There are significant challenges in that regard. The same is the case with respect to East Los Angeles. In the Antelope Valley has almost double the diabetes rate compared to what we know to be the national average. And so there is work to be done, a significant amount of work to be done. The good news is that we are on our way as a result of being awarded these resources to tackle these problems intelligently, strategically, creatively. And the good news beyond that is in the context of a larger discussion going on in our nation to deal with the question of health care. And if all goes well, ultimately, we ought to be able to land on health reform that will go far beyond where we are today in this nation to make sure millions more Americans get what they need in terms of health care, and to the extent that they are afforded the appropriate supports in that regard. What that means is that they have a fighting chance to deal with issues of diabetes, to deal with issues of obesity, to deal with a range of chronic maladies that define the quality of their lives and the lives of those in our community. It has far-reaching economic implications, and so this business of prevention and management of health in a proper way has far-reaching and positive possibilities. And so I'm pleased to be here today to commend the department and all of us for this very significant step forward. And I'm pleased that the federal government recognized once again that Los Angeles County has it going on. I give you now Dr. Fielding.